we know that? Well, it's fairly easy to get this information. We actually draw blood samples and measure hormone levels in dozens of patients over time, and when we do that, we can see that hormone levels measured in blood testing shows a decline with age. Declining hormone levels, we talked a little earlier about the importance of hormones. What do hormones do in the body? Hormones attach directly to the DNA in trillions of our cells and turn on protein production. Without protein production, we're unable to regenerate the body. The trillions of cells in our body must replicate to make new cells, and we must make new protein, new collagen, which is our structural protein. Collagen is the most abundant protein in the body, and if you listen to my good friend, Dr. Alvin Stein, no bones about it, he frequently talks about the importance of collagen in our joints, in our bones. For example, bones are made of collagen, our arteries are made out of collagen, our skin, connective tissue, every structural element, the hair, teeth, it's all made out of collagen. So without the ability to manufacture new collagen, our existing structural elements degenerate with the onset of osteoarthritis, degenerative osteoarthritis, and other degenerative problems, which includes heart disease is degeneration of the inner lining of the arteries. Dementia, Alzheimer's dementia is degeneration of brain tissue. Osteoporosis, degeneration of our bones, etc. Loss of immune function is degeneration of our immune function, of course, is another form of degenerative disease. The drug companies have a blockbuster drug for each form of degenerative disease. For osteoporosis, they have Fosamax, Actonel, and the bisphosphonate drugs, which I consider to be, quote, bad drugs. I don't recommend them for anybody. Number two, for heart disease, for atherosclerotic vascular disease, coronary artery disease, the drug companies have statin drugs, Lipitor, Crestor, Baycol, etc., which are of questionable benefit for the vast majority of people taking them. For loss of immune function, our ability to defend against infection, we have a class of drugs called the antibiotics, which of course are one of the great triumphs of modern medicine, the conquest of infectious disease with antibiotics. Instead of taking all of these blockbuster drugs, another one which we should mention is arthritis. Osteoarthritis is a typical degenerative disease of the joints, causing pain and dysfunction, loss of function of our joints, the knees, finger joints. The drug companies have, of course, we all remember Vioxx, which was a huge scandal. Vioxx was eventually banned because it caused heart disease. Other types of arthritis drugs, which are available at the corner grocery store, are called NSAIDs, non-steroidal anti-inflammatory drugs, and my good friend Alvin Stein talks about these on No Bones About It. The NSAIDs include ibuprofen, Aleve, naproxen, even aspirin is considered an NSAID. So these are all anti-inflammatory drugs that are given out for osteoarthritis. They do give short-term pain relief, but they will actually cause progression of the joint destruction, which is not a good thing. So my point here that I'm getting at is that in a much better, far more logical and more effective approach to preventing and reversing degenerative disease, all of these degenerative diseases, is and will be into the future bioidentical hormone supplementation. Because remember, all these degenerative diseases are directly caused by declining hormone levels and our inability to regenerate new cells and manufacture new proteins, reparative proteins, because of declining hormone levels. So it makes eminent sense. I mean, it's extremely logical, and it actually does work in clinical practice to give the population at large, we're talking 50, 100 million people who are reaching the age of 50 and above, all of these people, in order to stay healthy, should be on bioidentical hormone replacement to maintain hormone levels in a healthy, youthful range, which will then reverse and or prevent the onset of these degenerative diseases. There are 3 studies in the male population showing that low testosterone levels carries a 40% increase in mortality, and there are studies in women which show the same thing. I'm going to go through a couple of these studies. First we'll take a short break, and then when we come back we're going to talk about studies which show that hormone deficiency in women is associated with increased mortality, and how replacing hormone replacement and replenishing to healthy hormone levels is associated with better health. So the best is yet to come. Stay with us. We'll be right back.